Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Yemi Famuyiwa. She's a fertility specialist, and today's Kevin MD article is The Rise of At-Home Hormone Tests, a Double-Edged Sword for Patients. Yemi, welcome back to the show.
Hello, Kevin. Nice to be here.
All right, so tell us what your latest article is about.
All right. So, my latest article is about trying to decipher the confusion that patients sometimes have when they use a lot of at-home testing. So, it really came about because I've had a run of patients who've had different tests done, and then they don't get any directions on what the tests mean. And then they come to you
Hmm.
and they want a thorough explanation of what they should do with this test, what it means. I'm like, hang on a second. Who gave you this test?
Hmm.
Who made this test? Maybe we need to go back to them first.
All right, so tell us the type of tests that you're talking
Right.
about.
So there are some at-home monitoring things that are very, very useful. Don't get me wrong, such as the glucose continuous monitoring. That's
Hmm.
very good. I also recommend some ovulation apps for my patients. Those are good if used in conjunction with things like a urine LH surge, right? That's a valid, true, tried test.
Hmm.
But the one that got my attention was tests that are coming out measuring urine hormones or salivary hormones. And some of them will plot different graphs for patients and tell them, oh, your hormone looks like this, and it's got this wave pattern, it's got that wave pattern, and that's it. Now the patient's saying, oh my gosh, what do I do? What does this mean? Does it mean I'm, not going to get pregnant? I can't respond. They are confused. And the advice, some of these, not all, but some of these manufacturers now say, well, go to your doctor and let them explain it to you.
So, what are these hormone tests supposed to
Uh-huh.
measure and predict?
Right,
So, they're marketing that if you monitor your hormone levels with the saliva urinary
correct,
test, that can
right.
predict potential periods of fertility. What are they trying to sell?
They're trying to sell periods of fertility, or maybe they'll say we're doing a better LH surge measurement,
Hmm.
or indeed they're saying, well, we have a better measure of your estradiol,
Hmm.
or we can tell if your progesterone level is, within range. Question is, within range of what? And the particular patient I had, she also had an IUD in place. So then, what are the standards that these tests are measured against? And if you're measuring the urine metabolites, not the blood level of the hormone itself, the metabolites, what table are you using to convert that into real data to say, oh, X amount of metabolite is equal to Y amount of blood level,
Hmm.
right? Do we have that standardized? And what happens to someone who's already on a hormonal regimen? I had someone who was taking birth control pills and was also doing this at home test and saying, well, it's not looking like the graph. I'm like, well, hang on. Do you know you're already on some hormonal manipulation? So when you test these things, it even throws even more confusion into the issue. So I don't think the directions are clear. And if they are, you are performing a test that may necessarily normally be done, say, in a lab,
Hmm.
like LabCorp Quest, with a physician who's going to interpret it in light of where you are in your menstrual cycle. Now the patient has this test. It's not necessarily standardized. They're on hormonal treatment, or sometimes they may have different metabolic conditions going on, such as PCO, which also throws more confusion into the whole equation. And now they're super confused and they're told, go to your doctor.
So, for these at home tests,
Mm.
they don't give any direction for the patient to interpret the results. There's no color coded chart. It's simply
So some of
just see
them,
your doctor.
right, some of them may have color-coded charts, but let's be clear. The patients using this are not medical people.
Hmm.
They're just a lay audience. So you drawing a graph or a bar chart or a color code, what does it mean to them? How are they supposed to figure it out? Now, fertility by itself is super anxiety provoking. These patients are anxious, they're going through a lot. So when they do this, it further drives up their anxiety level.
Mm-hmm.
They'll come in fixated on some urine result and want you to, well, how does that tie in if I have a cyst? And they'll fixate on some of these things instead of saying, okay, let's step back a little, let's look at the whole picture, let my doctor interpret what's going on. Was it done in the luteal phase or in the follicular phase?
Mm-hmm.
You know, let somebody who actually is familiar with what these numbers should be order and interpret some of this. And if you're going to market it and sell it to patients, then you need to also set up a virtual consultation where you can tell them what it is they're measuring, how can they use it, and if you're not, then are you really practicing medicine in a non-regulated fashion? Because that's what, medicine is. That's what you and I do, right?
Mm-hmm.
You order a test, you sit a patient down, and you try to make sense of that test. But now the patient gets a test and nobody's making sense of it. And the conclusion is go talk to your doctor, right? So now when you now get blood test that doesn't match what they're looking at, they're further confused. So you need to make some head or tail of it for the patients. So I think that some of these tests may cause more confusion. I
Mm-hmm.
think they need to be standardized. They're not all bad, but they need to be standardized. And if the patient's going to use it, then let it be in conjunction with a physician, right? And then some of these tests also, another thing I noticed, because they're mostly out of pocket, they're not covered by insurance. But when you look at what they're measuring, I can get the same data more accurately from a blood test for a whole lot cheaper, right? You can send a blood lab to LabCorp Quest that'll charge you under $10 or under $15 for a test that some of these people are charging, $200 for, $300. I saw one, I wouldn't mention any names, that if a patient used it in the window that they're supposed to do, they would be spending quote almost like $300 to $400 each month that they use it. It doesn't cost that much to do a blood test if I need to. If I need to.
So it sounds like, especially with fertility and or hormones, there's
Correct.
just so much variability in terms of
Exactly.
the cycles.
Exactly.
So it's very difficult to
Exactly.
have these at-home tests that can measure something accurately with everything else, the variability that goes around it.
Right. Right. So, hopefully we will be, if they were standardized where I could say, okay, if I get this much salivary result of this metabolite, I can directly correlate it to this much of the blood result and take XYZ action, right? But then if I'm ordering it, I know exactly what time of the month I'm ordering it. Is it in the menstrual phase? Is it in the follicular phase? Is it in the luteal phase? And then what am I going to do with the result?
Mhm.
How am I going to use it? Am I using it to monitor response to treatment, or am I using it to check what their baseline is? And I don't think that that's necessarily clear. And what that results is almost punishment for the patient, who's already suffering from the agony of going through fertility.
Now, you're speaking through the lens of course, a fertility specialist, and you
Right,
practice in a metropolitan area. What about
right,
those patients who don't have access to fertility specialists and they
hmm
live in a rural area, perhaps,
correct.
and may not have a fertility specialist for hundreds of miles around them? Is there any utility for these at-home
I
tests
think
for
so.
these cases? Like, give like
Right,
ballpark ranges? Is there any utility at all?
right. I think there is some utility there. I think that when you are going to use this test, I think you want to use it in conjunction with a physician,
Mhm.
right? So, you can use the test in different phases, but I want to be able to have a physician monitor whatever response is being watched. Right.
Any red flags they should look out for to determine whether an at-home test is purely fraudulent? Is there anything that they should not purchase, or any warnings that they should look out for whenever they're looking for a potential at-home test?
The way I would look at it is if I'm going to send, because do have patients who are flying from Arizona or whatever, I think that the patient can be monitored again in conjunction
Okay.
with the physician. So yeah, you can send a patient to go get this test done out somewhere in rural, but you're watching it. You're looking at their response. You're making head or tail of it. I think that would be the best way to use it.
And in terms of these hormone tests, are you seeing at-home tests in any other areas? Anything else that you're seeing it, perhaps other than hormones?
I think for mostly for fertility purposes is where I think it's the most use. But if it's not being standardized, I think correctly, the manufacturers need to give a disclaimer.
Hmm.
They need to give a disclaimer to the public using it and say, okay, if you want to use this test, you have to say what the limitations are. What are the limitations of the test? I think that patients need to be aware of the limitations for that. Otherwise, you'll be practicing unregulated medicine.
So you mentioned the cost earlier. So just give me a
Correct.
sense of how much these tests cost whenever patients choose to purchase them.
Right. The one I looked at, I think it cost about $300 per cycle. And what they were measuring, if I ordered a blood test, or I think this particular one you looked at LH
Mhm.
released during ovulation. The urinary ovulation kit is fairly useful test to get, but if you're going to check it in some of these other kits that you would spend up to $200-300, I wonder if it's worth it to
Mhm.
do that.
We're talking to Yemi Famuyiwa. She's a fertility specialist, and today's Kevin MD article is The Rise of At-Home Hormone Tests, a Double-Edged Sword for Patients. Yemi, let's end again with some take-home messages that you want to leave with the Kevin MD audience.
I think my take home message for most people would be not to over perseverate on these hormone tests. You know, understand that it has some limitations. Read carefully. And if you're in doubt, check with your doctor instead of getting one test or the other, and it leads to massive confusion.
Mhm.
And that confusion can further drive up people's cortisol levels, which also drives up their anxiety and everything. And it's not a good thing for patients.
Yemi, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you very much.